until 3 years ago, he was a fairly fit man in his 80s. Then he had a serious operation. He had a hiatus hernia, spent about 8 weeks in Heartland, had a major operation, major surgery. Ever since then, he's had the onset of dementia, which has got increasingly worse as the years have gone on. He's also developed type 2 diabetes. He needs the constant care of my mum, who's his main carer. He's very, very reliant on her. She can't leave him on his own. She's got to be with him constantly. He basically just sits and he wants somebody to sit with him. He can't answer the phone anymore. He can't hold a conversation over the telephone. He needs help toileting. He needs help. If he goes anywhere in the house, he can't walk unaided. He needs someone, even if he's got his frame, he needs someone to walk with him because he's very unsteady, very prone to falls. He gets very confused. A care company, they come out 3 times a day, so once in the morning, once at lunchtime, and then in the evenings to put him to bed. Mum also has 2 hours, 3 times a week, sort of respite time for herself. I go over as much as I can. I live close, and my sister lives down in Sussex, so it's not so easy for her. She'll try and come up for a day once every month, 6 weeks. I normally have Dad every Friday for a few hours so that Mum can go out on a Friday after. He basically just sits and he wants somebody to sit with him. He gets very frustrated if I'm trying to do something else while he's there. And he's the same with my mum. He wants someone with him 24/7. It's I work, it's not something that I mind doing, but it has become a routine that every Friday I have my dad now. Yeah. After his stay in Heartlands 3 years ago, it was decided that he needed a catheter. They were advised that he had a suprapubic catheter fitted, and ever since then he's had so many infections, and that's really the main cause of him going in and out of hospital all the time now, when his infections become so severe. What we find frustrating is every time he goes in, somebody will say to us, well, why has he got that? And we don't really know. We were told that was the right thing to do, so we went along with the advice we were given. More often than not, Mum will have a phone call and say he's coming out this afternoon. So we've had no time to prepare. And we explained that the house wasn't ready, that we needed a stair lift, we needed an adjustable bed. We were told that he would be brought home by 2 ambulance men who would carry him upstairs, and there he would have to stay. He wasn't allowed to come downstairs without a stair lift because he wasn't safe. So basically he was going to have to just live in one room. There was no one in the hospital or the community that had to help. We rang Age Concern, but there was no real support there at all. They were supposed to come out and change the catheter. I think it's once every 6 weeks, and very often they wouldn't turn up. If Mum cancelled the appointment, very often 4 of them would turn up at once, which is obviously a waste of funds as well. Just the communication just doesn't seem to be there. We were promised physio care, and that's never happened. Very frustrating. The instance when he was last admitted to A&E, I don't know if it was a sister or a nurse came in. She did all his details and actually wrote them on a paper towel, which wasn't ideal. And then she disappeared. About 10 minutes later, the doctor came in. We had to go all the way through to everything all over again with him. And then when he goes onto the ward, we go through it again. And I don't understand why these notes can't be passed, to save all that time as well for them. One of the other things that really upset us was the treatment that he's had in hospital, and it's not all been horrendous. It's nothing like that, but it tends to be very different depending on which nurse or doctor is looking after him at the time. We've had instances when he's been on a ward whenever it's visiting time, when we need to speak to someone, because obviously Dad can't communicate with us what's happening. All the nurses are on their break, or there's no one around to speak of. I went in once. Dad was in an awful lot of pain. Managed to speak to a doctor in the evening, and he said, oh, well, hopefully he'll be better after he's had his operation tomorrow. We knew nothing about an operation. None of us had been told. He was on a ward that was specifically for dementia patients. He was so frightened. So that was when the care was the worst. I saw one of the nurses. One of the nurses went to touch him to give a tablet, and he flinched. And one of the others shouted, oh, watch him, he can be violent or something, or you've got to be careful with him. And I just thought, that's my dad. I don't think sometimes the staff realise how vulnerable you are. and how frightening that it is. I mean, I'm a professional person myself, but I feel like a child, you know, because you're like a fish out of water. You don't understand what's going on, and when there's that lack of communication, it makes it even more distressing for everybody concerned. Whereas, you know, primarily they should be trying to make it as supportive as possible, both for the patient and for the family. Very rarely sees the same doctor, and they care. They will come out, but it just seems like, well, we'll take these tablets, then we'll take these tablets, you know, and sometimes there's been an overlap on the tablets they're prescribing. Luckily, Mum is very much on the ball, and she will say, you know, well, he's had those and they don't work, or he's had those and it's caused this effect. He gets an awful lot of pain. Again, we don't know if it's his bladder or if it's his bowel. Every time he goes into hospital, this is something we keep saying, right, we're going to get to the bottom of this. Nobody ever has. So they just keep treating the pain, but we have no idea why it's there. So it just feels like it's one set of tablets after another, really, but never really getting to the bottom of the problem. But there's no guidance. There's nobody to say, you know, this is what you need to do. We rang social services, and we were told just to ring Age Concern and look on their website. But I really felt as though we needed someone to sit down and talk through what our choices are. I mean, we don't know how to go about looking at homes. We don't know which ones we can look at. Mum did have an assessment fairly recently, like a few months ago, with social services again. As far as I'm aware, in terms of the care, she's getting as much as she's entitled to at the moment. But because Dad's condition is changing so quickly, and you know, maybe things need to be looked at again, but there's no one to go to. There's no one to say, well, this is what you should be doing, or you know, try this. And I think I said to you last time when we started to investigate getting a stair lift, somebody told us that we could get funding for it. When I tried to find out about that, I was told it could take up to 12 months, which was, you know, we needed something there and then. And I will spend afternoons phoning around for things like that. There just doesn't seem to be the support within the community at all. We get passed from one person to another person to another person. Every time he's admitted, we have to go all through his history, not just once, twice, 3 times sometimes with different people. And it becomes really frustrating. Better communication, not just between sort of the doctors and the hospitals and the specialists, but between the doctors and the nurses within the hospitals as well. Better communication between the staff who are caring for patients like my dad and the family. We never feel as though we've got anyone to go to talk to. More support for people like my mum, you know, sort of, right, this is what you do, this is who you can call. Just to sort of give her that support that she needs as well.